physical therapy and fitness here. Today we're going to talk about relieving pain through the IT band. The IT band is a band of connective tissue that runs down the outside of the leg and attaches all the way into the knee on the outside. Where most people go wrong right off the bat is that they tend to attack that IT band, whether it's with massage or some of their own foam rolling. And as I said before, the IT band is actually connective tissue, not muscle. So in order to get the IT band to feel better, you actually need to address the muscles that are attaching into that IT band. The first muscle we want to talk about is the Tensor fasciae latae, which is actually up in the hip. That turns right into that IT band. So that's the very first muscle that needs to be released. When we're talking about muscle tension and muscle knots, you really want to do some soft tissue work before you do any type of stretching. If there's a knot in a muscle, you cannot stretch out a knot. It's like taking your rope with a loose knot in the middle of it, pulling the ends of those rope, and then what happens? The knot gets tighter. So the same thing happens with your muscles. So a great way to help relieve some of the tension through that muscle is to use a ball, whether it is a lacrosse ball or a tennis ball, which is a little bit softer, so it's a little more gentle on the muscle if it's really sore. You're going to take that ball, put it down onto the floor, and you're going to lie right on your side, directly on top of that ball. So find the top of that hip, come forward a little bit, and then find that sore spot in that muscle. Once you find it, and you'll know when you have found it, you're going to take that bottom leg and you're going to rotate it up and down. That helps to relieve some of that tension. The other option is to just roll your body back and forth if that feels a little bit better for you. You're going to do this until it starts to feel better. That is so different for every person. So it might take 30 seconds, it might take 2 minutes. But you want to make sure you hang out there until it starts to feel better. Once that feels better, then you can move on to the other muscle, which is the quadricep muscle, so that muscle in the front of the leg and the outside of that quadricep muscle. That muscle, again, attaches right into that IT band. So to help relieve that a little bit, again, you can use the ball, and you're going to lie on your side, again, and then come forward a little bit. This time, that bottom leg, the knee is going to bend and straighten. Whew. I noticed that I was holding my breath there. Remember what I said. It's really important to breathe through things and let your body relax. If you're not able to do that, you need to use something else, which is what I'm going to show you next. So you want to do this until you feel, again, that it doesn't hurt so much. If that is way too painful and you can't breathe, you can't let your body relax, you can take actually a rolling pin, which most people have at home, or this fancy schmancy item called the stick, which you can even get online. But this is a little less pressure because you're not placing your body weight on it. You take it and you roll it right up and down that muscle. Not on the IT band, right through that quad muscle. Same guidelines apply. You want to do it until you feel a little bit better. Once you're done with that, you've released some of the knots in the quadricep, you've released some of the knots in the TFL, you can go ahead and actually stretch those muscles out. So a great way to stretch the TFL is in a kneeling position. I like to do it with a little bit of a pillow just to cushion the knee. So if we're stretching out the left side, it's the left knee that's going to go down on the pillow, right leg is going to go in front. You actually want to cross that right leg over a little bit so that you don't let that left leg collapse out. You can even add a little rotation if you take your lower leg and bring it out. Keeping those abs, of course, nice and tight. Back straight, you're going to lean forward. So you're stretching out the other hip flexor muscles at the same time, which is always good. And you're getting right into that small muscle that attaches to that IT band. People who sit a lot, people who run a lot, those muscles are just going to get tight no matter what you do. So it's important to really work on these. So I like to hold stretches for 1 to 2 minutes. You really want to make sure that you hold it for as long as you can to be able to let yourself relax and get a little bit more range of motion into it. Once you're done holding, you can come right on out of that. And you can add in the quadricep muscle to stretch too. So, as long as you have no pain doing this, if you grab that foot or ankle and bring that heel up towards your butt, you're going to get a nice stretch right through the front of that leg. If that feels too much for you, you can always do it on your side as well. So that if I were to lie on the opposite side, and then go ahead and grab that heel and bring it up towards my butt, and even bringing the knee back a little bit, that's a lot less pressure that goes through the knee, and it's much easier to do. So, the key things to remember here are release the muscle first and then stretch it. Once you do that, you should be all set. Make sure that you try to do this every other day, and you should start to feel a lot better. Thanks for joining me today, and if you want more helpful tips on health, nutrition, fitness, and exercise, subscribe to my YouTube channel. Thanks guys, this is Dr. K from Momentum Physical Therapy and Fitness.